Have you ever felt a strange, unexplained sensation in your body and wondered if it was something serious? Maybe it's a sudden wave of exhaustion, a sharp pain in your chest, or a moment when you just can't catch your breath. The truth is, your body might be trying to tell you something critical, and ignoring these warning signs could mean the difference between life and death. In this video, we're diving into 6 deadly symptoms that doctors say you should never overlook, signals that could mean your time is running out. Stay with me until the end, because this information could save your life, giving you the knowledge to act fast and take control of your health before it's too late. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the message of the importance of health. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now, let's get started. Number 1. Unexplained extreme fatigue. There's a world of difference between the ordinary tiredness you might feel after a busy day or a restless night and the kind of profound, bone-deep exhaustion that hits you without any apparent cause. This isn't the kind of fatigue that comes from a late night out or a tough workout. It's a relentless, pervasive drain that lingers even after you've had plenty of rest. Imagine waking up after 8 or 9 hours of sleep, yet still feeling as though you haven't slept a wink. Or finding that basic tasks like getting out of bed, brushing your teeth, or walking to the kitchen suddenly feel as insurmountable as climbing a mountain. If this sounds familiar, it could be your body's way of sounding an alarm, signaling that something far more serious is brewing beneath the surface. This type of extreme fatigue doesn't just go away with a strong cup of coffee, an energy drink, or a quick power nap. It clings to you like a heavy, invisible weight, slowing your every move and clouding your mind. Maybe you used to be active, taking daily walks, running errands, or keeping up with hobbies, but now even a short stroll to the mailbox leaves you breathless and wiped out. Perhaps routine activities like preparing a meal, getting dressed, or holding a simple conversation with a friend have started to feel overwhelming, as if your energy reserves have been completely tapped out. This isn't just a natural part of getting older, nor is it something you can chalk up to a busy schedule. It might be a red flag that your body is in distress, struggling to keep up with its most basic functions. What would be causing this? Doctors often see this kind of debilitating exhaustion in patients with serious underlying conditions. It might mean your heart isn't pumping blood effectively, leaving your muscles and organs starved for oxygen, a common sign of heart failure or cardiovascular disease. It could indicate that your kidneys are faltering, allowing toxins to build up in your bloodstream, which saps your strength and vitality. In some cases, it's a symptom of advanced cancer, where the body redirects all its energy to fight the disease, leaving little for anything else. Essentially, when your system is in survival mode, prioritizing critical processes over everyday activities, this crushing fatigue becomes a hallmark warning sign. One key clue is the suddenness or progression of this exhaustion. If you've always had decent energy levels, but now find yourself inexplicably weak, sluggish, and drained without a lifestyle change to explain it, that's when it's time to sit up and take notice. It's not just about feeling off for a day or two. It's a persistent shift that disrupts your life. Maybe it started subtly creeping up over weeks or months, or perhaps it hit you all at once like a switch flipping off. Either way, your body isn't merely tired. It's trying to tell you that something deeper, potentially life-threatening, is happening beneath the surface. So what should you do if you're experiencing this? Start by paying close attention to the details. When did this fatigue first appear? Does anything specific like physical activity, stress, or even eating make it worse? Has it begun to rob you of the things you once enjoyed, like spending time with loved ones or pursuing your passions? If it's worsening over time and interfering with your ability to function day to day, don't brush it off or assume it'll pass on its own. Schedule an appointment with a healthcare professional as soon as possible. Be honest with them about how you feel, even if it's hard to put into words. The sooner you investigate the cause, the better your odds of catching a serious condition early potentially stopping it in its tracks before it spirals out of control. Ignoring it won't make it go away. It might only give whatever's wrong more time to take hold. Number 2, sudden and severe chest pain or pressure. There's one sensation that should set off every alarm bell in your mind: a sudden, intense, crushing pain or pressure in your chest that you can't ignore. This isn't the mild ache you might get from sleeping in an awkward position or the fleeting twinge of indigestion after a heavy meal. It's a deep squeezing or heavy sensation that feels like an elephant sitting on your ribcage. If this comes on abruptly, especially if it radiates outward to your left arm, shoulder, neck, jaw, or back, you could be teetering on the edge of a medical catastrophe. Medical experts universally agree that chest pain of this nature is often the calling card of a heart attack, or an even rarer, but equally deadly condition called an aortic dissection. Too many people make the tragic mistake of dismissing it as something minor, thinking it's just gas, a pulled muscle, or stress, only to realize too late that it's a life-or-death emergency. Let's break it down. The classic heart attack, pain often feels like a vice tightening around your chest, making every breath a struggle. It might build gradually, starting as a vague discomfort before intensifying into something unbearable, or it could strike out of nowhere like a sudden, brutal punch to the sternum. But here's the tricky part. Heart attacks don't always announce themselves with Hollywood-style theatrics. For some, the symptoms are subtler: a nagging unease in the chest, a strange heaviness in the upper body, or even just an odd feeling that something's not right. These can be accompanied by other warning signs like nausea, lightheadedness, cold sweats, or shortness of breath. Because these clues can be so easy to downplay, many people delay seeking help, convincing themselves it's not serious, sometimes with fatal consequences. Then there's the other possibility: an aortic dissection. If the pain is sharp, tearing, or feels like something is ripping apart inside your chest, it could mean the wall of your aorta, the massive artery that carries blood from your heart to the rest of your body, is splitting open. This is a surgical emergency of the highest order. Without immediate intervention, it can lead to massive internal bleeding, organ failure, and death within hours, if not minutes. Unlike a heart attack, which might give you a small window to act, an aortic dissection is a ticking time bomb with no room for hesitation. So how should you respond if you experience sudden, severe chest pain or pressure, especially if it's unlike anything you've felt before? Don't second-guess yourself. Don't lie down hoping it'll pass. Don't pop an antacid and wait out. And don't tell yourself it's just anxiety or overwork. Time is your enemy here. Pick up the phone and call emergency services immediately. Don't drive yourself to the hospital, as you could lose consciousness en route. While you wait for help, stay as calm and still as possible to avoid putting extra strain on your body. Tell the dispatcher exactly what you're feeling, including when it started and any other symptoms, so they can prioritize your case. The bottom line is this: acting fast can mean the difference between walking out of the hospital and not making it at all. When it comes to severe chest pain, it's always better to err on the side of caution and let the professionals figure out what's wrong. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3, difficulty breathing or shortness of breath. Picture this. You're sitting comfortably in your favorite armchair, perhaps sipping tea or flipping through a book, not exerting yourself in the slightest, when out of nowhere, a strange sensation creeps in. Your chest tightens, and it feels as though the air around you has thinned, like you're stranded on a mountaintop with less oxygen than your lungs demand. You take a deep breath, then another, but it's not enough. It's as if an invisible weight is pressing down, making every inhale a struggle. This isn't just a fleeting moment of discomfort. It's a glaring, urgent warning sign that something could be seriously wrong. Medical experts emphasize that unexplained shortness of breath, especially when it strikes suddenly or worsens progressively, is often your body's desperate SOS signaling that a critical system is faltering. What could it mean? The possibilities are as varied as they are alarming. One of the most common culprits is advanced heart failure, where the heart, weakened and overworked, can no longer pump blood efficiently. As a result, fluid seeps into the lungs, drowning the air sacs that should be filling with oxygen. You might notice it most when lying flat. Your breathing becomes shallow and labored, and you may even jolt awake at night, gasping for air as if you've just surfaced from underwater. Another terrifying possibility is a pulmonary embolism, a life-threatening condition where a blood clot, perhaps dislodged from a vein in your leg after a long flight, car ride, or recent surgery, travels to your lungs and blocks a vital artery. The onset can be deceptively subtle, a slight tightness in your chest, a vague unease, then in an instant, it escalates to a suffocating sensation as though the oxygen is being squeezed out of your bloodstream. Then there's the silent heart attack, a stealthy predator that doesn't always announce itself with the dramatic chest-clutching pain you see in movies. Instead, it might manifest as overwhelming shortness of breath paired with nausea, clammy sweats, or a bone-deep fatigue that drags you down like quicksand. Too many people brush it off, chalking it up to age, stress, or a bad night's sleep. I'm just out of shape, they tell themselves, or this will pass. But when breathlessness strikes without a clear trigger, say after climbing stairs or even sitting still, it's a symptom you can't afford to dismiss. Doctors warn that time is of the essence here. A pulmonary embolism can kill within hours if untreated, and a heart attack's damage grows with every minute you delay. So, what should you do if shortness of breath hits you out of the blue, especially if it's severe, sudden, or paired with chest pain, dizziness, or a racing heart? Don't hesitate. Sit down, try to stay calm, and call for help immediately, whether that's dialing emergency services or getting someone to rush you to a hospital. Conditions like these often require swift intervention, clot-dissolving drugs, oxygen therapy, or even surgery. Every second you wait could tip the scales between survival and catastrophe. Ignoring it isn't bravery, it's a gamble with your life. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 4, drastic and unexplained weight loss. At first glance, shedding a few pounds without effort might seem like a welcome surprise, a free pass to a slimmer waistline without the grind of diet or exercise. But when the weight keeps melting away week after week and you haven't changed a thing about your routine, that initial thrill can sour into dread. Your jeans hang looser, your belt notches tighter, and friends start commenting, "You look thinner, everything okay?" If you're not trying to lose weight and the scale keeps dropping, it's not a gift. It's a potential harbinger of something sinister lurking within. Physicians sound the alarm about rapid, unintentional weight loss, particularly in older adults, because it's often a red flag for advanced illness. One of the most feared causes is cancer, especially types that strike silently at first, like pancreatic, lung, or gastrointestinal cancers. These diseases can hijack your metabolism, turning your body into an energy incinerator that burns through calories and muscle at a relentless pace, even if you're eating as much as ever. By the time other symptoms like pain or fatigue show up, the cancer may already be entrenched. But cancer isn't the only suspect. Severe metabolic disorders, such as hyperthyroidism or undiagnosed diabetes, can also send your weight plummeting. In diabetes, for instance, your body might start breaking down fat and muscle because it can't use sugar for fuel, leaving you inexplicably thinner and weaker. Heart failure, too, can play a role, particularly in its later stages when your heart struggles to circulate blood. Digestion and nutrient absorption suffer, and your appetite might vanish, leading to a slow, steady wasting away. Then there's chronic inflammation or hidden infections. Think tuberculosis, HIV, or autoimmune conditions like rheumatoid arthritis. These silent battles tax your immune system, siphoning off energy reserves and stripping away pounds without you noticing until your reflection in the mirror looks gaunt and unfamiliar. It's not just about the numbers on the scale. You might feel increasingly frail, tired to your core, as muscle mass fades and your strength ebbs. So what's the threshold? Experts say losing more than 5% of your body weight, say 8 pounds if you weigh 160, over a few months without trying is a serious signal. Don't shrug it off as a perk of aging or good luck. Make an appointment with your doctor, push for thorough testing, blood work, imaging, whatever it takes, and demand answers. The earlier you uncover the root cause, whether it's treatable or something more dire, the better your odds of halting its progression. Waiting risks giving a silent killer more time to tighten its grip. Number 5, confusion, disorientation, or sudden personality changes. There's an eerie, almost surreal quality to the sensation of losing touch with your mind or watching it happen to someone you care about. When confusion, disorientation, or abrupt shifts in personality emerge without warning, it's not just unsettling. It can signal a profound and potentially life-threatening problem deep within the brain. Imagine someone who's always been sharp and quick-witted suddenly struggling to remember where they are, mixing up simple words, or behaving in ways that feel completely out of character. These aren't mere quirks or fleeting moments of absent-mindedness. They could be the brain crying out for help. Medical experts emphasize that a rapid decline in mental clarity, especially when it strikes out of the blue, is often a red flag for serious conditions like a stroke, a brain infection, or even an aggressive neurological disorder. Take a stroke, for instance. It can hit like a lightning bolt, leaving behind a trail of confusion, garbled speech, or an inability to recognize familiar people, places, or objects. 1 minute, everything seems fine, and the next, the world feels like a scrambled puzzle. Some individuals might experience a brief, odd episode, perhaps a few minutes of disorientation or a strange lapse in awareness, only to snap back to normal shortly after. Don't be fooled by the recovery. This could be a transient ischemic attack, TI, a mini-stroke that serves as a chilling preview of a larger, more devastating event if the underlying issue isn't addressed. Then there's the possibility of a brain infection, such as encephalitis or meningitis, which can wreak havoc on mental function with alarming speed, particularly in older adults. Infections can spiral out of control, triggering a state of delirium, a foggy, disoriented condition that might make someone seem agitated, withdrawn, or unable to string thoughts together. Picture an elderly parent who suddenly can't follow a conversation, grows restless or hostile, or stares blankly when asked a simple question. It's tempting to chalk it up to just getting old, but age alone doesn't flip a switch like that. Infections can spread through the bloodstream or breach the brain's defenses, causing swelling and chaos that demand urgent care. Neurological diseases like Alzheimer's or other dementias also loom as possibilities. While these conditions typically creep in gradually, eroding memory and reasoning over years, certain cases or related disorders, like vascular dementia, can manifest with a startling sudden drop-off. Someone might lose track of entire days, forget what they did an hour ago, or fumble through tasks they've done effortlessly for decades, like tying a shoe or making a sandwich. The danger lies in dismissing these changes as normal aging. They are not. When the brain's machinery starts to break down at an accelerated pace, it's often a sign of an underlying crisis, be it restricted blood flow, toxic buildup, or cellular decay that could prove fatal if ignored. So what's the takeaway? If you or someone around you experiences a sudden shift in memory, awareness, or behavior, whether it's forgetting the day of the week, acting unusually aggressive, or seeming lost in familiar surroundings, don't hesitate. Seek medical attention immediately. These symptoms could stem from a stroke, cutting off oxygen to the brain, an infection gaining ground, or a neurological condition accelerating beyond control. Time is the brain's most precious currency, and every passing minute without intervention could mean the difference between recovery and irreversible damage, or worse. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 6, severe and persistent abdominal pain. A stomach ache might sound trivial, something you'd shrug off with a glass of water or an antacid. But when the pain digs in deep, grows razor sharp, or lingers relentlessly, it's a warning that something inside your body might be unraveling in a way that's far more sinister than a bout of indigestion. Physicians caution that severe abdominal pain, especially when it strikes suddenly or drags on for hours without relief, can be the body's desperate SOS, an alert to a breakdown that could turn deadly if overlooked. Consider the terrifying prospect of a ruptured abdominal aortic aneurysm. This occurs when a weakened bulge in the aorta, the massive artery that ferries blood from the heart to the rest of the body, tears open, unleashing a torrent of internal bleeding. The pain is often described as a profound, gnawing ache that burrows into the abdomen, lower back, or sides, sometimes pulsing in sync with a heartbeat, like a grim metronome. It's not subtle, and it doesn't ease up. If this happens, death can come within minutes unless emergency surgery intervenes. Risk factors like high blood pressure, smoking, or a family history of aneurysms amplify the stakes, making it all the more critical to recognize this pain for what it is, a race against the clock. Another dire possibility is intestinal ischemia or a blockage. Picture the intestines, a sprawling network of tubes that process everything you eat, suddenly starved of blood flow due to a clot, a twist in the gut, or even a tumor pressing down. The result, a searing, unrelenting pain that might leave the belly swollen, rigid, or excruciatingly tender to the touch. If bowel movements stop or turn abnormal, say bloody or non-existent, it's a glaring sign that something's wrong. Left untreated, the tissue can die off, leading to perforation, infection, or sepsis, a systemic poisoning that can shut down organs in a matter of hours. Then there's pancreatitis, where the pancreas, a small but vital organ tucked behind the stomach, becomes inflamed and unleashes a firestorm of pain. This agony often starts in the upper abdomen, sharp and burning, sometimes clawing its way to the back like a hot knife. It can flare up out of nowhere, worsening after a meal or a drink, turning even the thought of food into a nightmare. Triggers like heavy alcohol use or gallstones can set it off, and if it escalates, the inflammation can spiral into complications like kidney failure or respiratory distress. Speaking of gallstones, a gallbladder attack is another culprit, delivering a stabbing, cramping pain under the right ribs, often sparked by a fatty meal. Too many people write this off as gas or heartburn. But when stones block the ducts or infection sets in, the consequences can be catastrophic. So, what should you do if you're doubled over with abdominal pain that won't quit? Don't wait it out or hope it's nothing. Rush to a doctor or emergency room, especially if the pain comes with fever, nausea, vomiting, racing pulse, or a sudden drop in energy. Some of these conditions, like a ruptured aneurysm or a dying intestine, demand immediate surgery, and every hour of delay tips the scales toward a graver outcome. Others, like pancreatitis or gallbladder disease, might need urgent treatment to halt the damage. The abdomen is a complex battlefield, and persistent pain is its way of sounding the alarm. Heed it, because the cost of ignoring it could be your life. That brings us to the end of this eye-opening journey through the 6 deadly symptoms you should never ignore after 60. We've covered everything from that overwhelming fatigue that creeps up out of nowhere to the sudden chest pain that could signal a heart attack, to the shortness of breath or abdominal pain that might mean something far more serious than you think. These aren't just random aches and pains. They're your body's way of waving a red flag, begging you to pay attention before it's too late. By making it this far, You've armed yourself with knowledge that could truly make a difference. Maybe even save your life or the life of someone you love. Now, I want to hear from you because your thoughts matter. What you learned so far from this video? Maybe it's recognizing that unexplained exhaustion isn't just getting older, or realizing that a sharp pain in your stomach isn't something to brush off. Take a moment to reflect. What stood out to you the most? Please share in the comments below one thing you've learned today and how you plan to bring it into practice in your life. Maybe you'll start paying closer attention to your body signals, or maybe you'll encourage a loved one to see a doctor sooner rather than later. Your story could inspire someone else watching this video to take action too, so don't hold back. If you found this video helpful, we'd love your support to keep bringing you